Hello, my name is Evan Nelson. I'm doing the health education review here for you, and it will be over IV drug use and risk for transmission of hepatitis C. At this time, pause and please take the pretest. Now, the population at risk. This is individuals with substance abuse or history of substance abuse that currently use or have used drugs intravenously. There's no specification of age, gender, or ethnicity or race because addiction is not prejudice. It affects everybody equally. Learning objectives. They are listed here. We have 5 of them. They are also listed on your trifold handout that I gave you. Keep this handy during the entire presentation because it will have spots for you to fill in that will help with your post-test and kind of keep that information fresh. So the learning objectives are, at the conclusion of this video, the viewer will recall the etiology and symptoms of hepatitis C. The viewer will name risk factors for contracting hepatitis C. The viewer will explain how hepatitis C is contracted through individuals with substance abuse disorder. The viewer will apply preventive measures in order to prevent hepatitis C in the population at risk. And lastly, the viewer will recognize what medication-assisted treatment is and how this treatment helps prevent contraction of hepatitis C. Now, the etiology is hepatitis C is a disease of the liver, and it's caused by the hepatitis C virus. It can be an acute infection that can clear up out of your immune system by your own body fighting, which doesn't happen often. More than not, in 80% or more of the cases, it leads to the chronic illness that we all know as chronic hepatitis C. That can lead to liver failure, liver damage, or even liver cancer. The incubation period is about 2 weeks to 6 months. This means in this time you won't be seeing a lot of symptoms, which is indicated right here. And about 80% of people during the incubation period, there are no symptoms that are present. So a lot of people don't even know that they are infected by the virus in the first place. As you can see, there's all the symptoms right there. To name off a couple, there's fever, vomiting, nausea, decreased appetite. There will be joint pain, jaundice, which is the yellow color of the skin and the whites of the eyes, gray colored stool, and dark urine as well. Risk factors for transmission of hepatitis C. Any kind of IV injection drug use. This is also known as the most significant risk factor. Transfusion of blood products, which was a problem before 1992. After that, they started to monitor it a little better, as well as for organ transplant, which is monitored much better now. Body tattoos and piercings, which also, you're dealing with needles and blood there, so if they're not sterile with their tools, then that has a very high risk. And male-to-male sex as well for the risk of contact with blood. Now, how is the hepatitis C virus transmitted? It is transmitted with direct contact with blood of an infected person. You have to be in contact with the blood, not the skin, the blood. Not any of the other bodily fluids necessarily, the blood. Again, IV drug use, improper use of medical equipment, accidental needle sticks by medical personnel, unscreened transfusion transplants, which again is not that much of a problem anymore, and unprotected sex that could lead to exposure of blood, most common in male to male, as stated before. Now, testing and diagnosis, as well as treatment. The treatment is not very in depth, but there is the main treatment option that's posted there that I'll go over. First is the test for anti-HCV antibodies in the blood serum. This is a blood test. They take a blood sample and they test specifically for this. If that is positive, you then go to step 2. Step 2 is testing the nucleic acids for hepatitis C virus ribonucleic acids, RNA, which if they test positive for that, that means that the chronic illness is present. They have to do both steps, and they have to be positive for both steps. The treatment, pangenotypic direct-acting antivirals, is the treatment of choice for chronic hepatitis C. This can be used for kids of all up to the age of 12 and older. They're actually starting to do research to help with kids that are younger than that as well. The treatment regimen is pretty short too. It's about 12 to 24 weeks, which is significantly lower than it used to be. Prevalence and incidence rates. This was done by a study, HCV epidemiology in the United States. It went up to the year of 2016. It was released earlier this month in 2019, and the information they use is the National Health and Nutrition Examination Survey. Now the prevalence rate, hepatitis C is the most common blood-borne pathogen in the United States, and the prevalence rate read that. However, there is a recent decrease in the prevalence rate because of the treatment for hepatitis C is much more readily available. And they're coming out with generic versions of these treatments, which makes it more affordable for many more people. So they're actually seeing less people testing positive for HCV RNA, which is that second step. Now, with this examination survey, they don't test the incarcerated people, poverty, impoverished areas, and many other high-risk populations aren't necessarily included in that survey. So there is note that even though there is a decrease, there's a lot of people that don't, a lot of the people, as we said, that aren't even showing symptoms. Incidence rate, there was a peak in 1989, but after they started monitoring blood products and they became more aware of hepatitis C, there was a steady decline until 2006, where it kind of flatlined and it plateaued for a little bit up until 2010. Now in 2011 through 2016, there started to become a steady increase. That steady increase is due to the opioid epidemic that is present in our country today. So as you can see, it really improved for a long time, and then now we're steadily going up because IV drug use is very prevalent now. The opioid crisis, this just goes over the Opioid Crisis Response Act. With that, the Senate acted in 2018 and it was passed. The House of Representatives, they're still trying to get on the same page with everything, but there's still a lot of federal funding that was passed to put forth towards opiate treatment, education of staff at hospitals, education of students, and just to get better treatment for opioid and opioid crisis as well. Preventive measures. Now these are the primary prevention. There is no vaccination, which would be the main primary prevention. But so this just goes to reduction in exposure to hepatitis C, which would be through safe handling of sharps, effective treatment for addiction. If you're abstaining, obviously you don't have the risk anymore. Harm reduction services for addicts, which is needle exchange. You have competent training of healthcare personnel. Tests donated is now all tested for hepatitis B and C, and safe sex practices. Secondary prevention, counseling and education on treatment options. Vaccination for hepatitis B and A, so that helps with co-infection, which can lead to increased damage of your liver. Regular screening, so getting those blood tests, as we talked about in slide 8. Receive prompt treatment. If you do test positive, don't wait. And then tertiary prevention is treatment of hepatitis C to prevent further damage of your liver, or to have complications such as liver failure and everything that was explained before. Medication assisted treatment. This is the use of medication along with behavioral therapies in treating substance abuse and opioid addiction. The three main medications are naltrexone, which is also given in a injectable form called Vivitrol, methadone, and Suboxone and Subutex. At this time, I would please like you to take the post-test. And here are your answers to the post-test. And here are some references and some additional resources for you. I appreciate you listening. If you have any questions, just put them in the comments section. Thank you.